As we cover your health this evening, cases of a virus usually associated with pets is now on the rise in humans, and it's prompting a new warning from the CDC. News 15's medical editor, Dr. John Lepre, explains how this version of Parvovirus is different than what you normally see in dogs and cats.
The CDC has just issued a health alert for Parvovirus. This is a highly contagious respiratory illness, and we're seeing an increased number of cases. We're currently seeing a 13-fold increase in activity compared to December of last year, and this comes just as kids are returning back to school. Parvovirus is a very common upper respiratory illness. The symptoms tend to be mild, with fever, fatigue, and joint aches. However, some develop a characteristic slapped cheek rash. Fortunately, most symptoms resolve in about 2 weeks. This is fairly common in children, with about 2/3 of adults showing prior infection. Now, we're particularly concerned with those who are elderly, pregnant, or have a weakened immune system. They can have more serious problems like reduced blood count, or in the case of pregnancy, harm to the fetus. An important note, we're talking about Parvovirus B19. This one infects humans, and it's different from the one in cats and dogs. You do not get this from your pet, nor can you give it to them. Unlike your pet, there's no vaccine for humans. However, exposure to Parvovirus is felt to leave you with lifelong immunity. There is no treatment, but the advice should be familiar to you by now. Isolate when you're sick, cover your mouth when you cough or sneeze, and wash your hands. The best treatment is prevention. And that's why you should take note of this outbreak, particularly high-risk individuals. Wishing you better health, Dr. John Lepre, News 15.